Welcome back to the Health Policy Doc, the intersection of healthcare, public policy, and politics, where healthcare reform, the latest in health policy, and the politics of healthcare are examined. I'm Tom Clear, an author and health policy professional. Thank you for joining us today as we tackle the ever-changing healthcare landscape. The Health Policy Doc's focus is on healthcare reform. Reform can occur in many ways. At the system level, it can be helpful to examine how other countries deliver healthcare. Healthcare reform can also take place on the ground, in communities, in doctors' offices, in hospitals, where better ways of delivering care or improved treatment plans are developed. Today, we are going to examine racial equity in healthcare. One of the goals of the Health Policy Doc is to contribute to the discussion around finding a way for everyone to have access to health care. One of the ways we do this is by examining different health systems around the world. We try to learn what works, what doesn't, what is cost-effective, and what isn't. In order to achieve access to health coverage for everyone, we have to make sure that not only is health coverage available for everyone, but also that everyone is able to access it. A critical piece of access to healthcare for everyone includes racial equity. We know that in the United States, African Americans have greater barriers to accessing healthcare than other populations. Racism, poverty, transportation barriers, high levels of unemployment, and many other factors create a barrier to just accessing healthcare for many in the African American community. The first measure we will examine today is life expectancy. A Kaiser Family Foundation study using Centers for Disease Control and international data on life expectancy identified that the life expectancy in the United States for the non-Hispanic Black group is 74.9 years of age. The life expectancy in the United States for the non-Hispanic white group is 78.5 years of age. The life expectancy in the United States for all races combined is 78.6 years of age. And the life expectancy in comparable countries for all races combined is 82.3 years of age. The data shows a significant lower life expectancy in the non-Hispanic Black population. While other factors besides access to healthcare may contribute to the difference, any healthcare reform must include steps to eliminate the barriers the African American community experiences to achieve racial equity and true equal access to healthcare. Whatever part of the lower life expectancy for the African American community that's related to healthcare or access to healthcare must be eliminated by any healthcare reform that is pursued. The next measure we will look at is death rates for leading causes of death. In the study, death rates per 100,000 population indicated a death rate for all causes of death as 851 blacks per 100,000 people compared to 735 whites per 100,000 people. Looking at diseases of the heart, the study showed 205 blacks per 100,000 population compared to 167 whites per 100,000 population. Looking at strokes and related conditions, the data indicated that 50 blacks per 100,000 population die from those conditions compared to 36 whites from those same stroke and related conditions. From diabetes, the study indicated 37 blacks per 100,000 population die compared to 19 whites per 100,000 population. And the last category or leading cause of death that's examined in the study found that for HIV, 8 blacks died per 100,000 population compared to just 1 white per 100,000 population. So the data shows a significant difference in the death rates between black and white populations for the leading causes of death due to medical conditions. These measures that examine death rate disparity between black and white populations have a strong correlation or link to access to medical care. Unaddressed hypertension contributes to death from stroke and heart disease. Late detection of cancer contributes to death from cancer. And untreated diabetes contributes to death from heart disease and many other causes. It's unconscionable and unacceptable that in the richest country in the world, a segment of the population has such a significantly lower life expectancy and significantly higher death rate from medical conditions that can be treated. Racial inequities in healthcare are a public health emergency. In the United States, a public health emergency declaration releases resources meant to handle an actual or potential public health crisis. The National Disaster Medical System Federal Partners Memorandum of Agreement defines a public health emergency as an emergency need for healthcare services to respond to a disaster, significant outbreak, bioterrorism attack, or other significant or catastrophic event. When the United States declared a public health emergency for swine flu, there were just over 1,000 deaths from the virus in the United States. When the United States declared a public health emergency for COVID-19, there were no deaths yet from the virus in the United States. While racial inequities may not fit neatly into that framework for a declared public health emergency, it does not make it any less a public health emergency. By using the disparity between death rates between black and white populations and applying it to the estimated 47 million African Americans living in the United States today, we see an additional 54,900 deaths in the African American population annually compared to white population simply because they are black. So what is the answer to racial inequities in healthcare? Well, racial inequities in healthcare can't be resolved solely through healthcare reform. There are many other variables that play a role, including employment and income, transportation, access to nutritious food, education, literacy, and numerous other social and economic variables. But health policymakers need to address what they can in the health reform space. Some steps to address racial inequities in healthcare include attacking racial inequities in healthcare as a public health emergency, release funding, other resources to come in and attack the problem head on, provide insurance coverage and access to high quality care for everyone. Currently, there are around 30 million people who have no insurance coverage in the United States. Many of those are in the African American community. Invest more in the Medicaid program to attract more providers to the network to provide greater access to care for everyone. Currently, Medicaid provider networks have far less providers than the comparable networks for private health insurance, and this results in many communities effectively not having critical specialties available because in order to access them, someone would need transportation to travel a far distance. The service wouldn't be available in that city or county where the individual lives. This type of subtle barrier impacts African American communities disproportionately due to income and transportation barriers. We need to promote a diverse healthcare workforce, incentivizing the hiring of underrepresented minorities in the healthcare field. We need to deliver patient-centered medical care to everyone. The patient-centered care model includes respect for patient values, preferences, and expressed needs, involving patients in decision-making, recognizing they are individuals with their own unique values and preferences, and treating patients with dignity, respect, and sensitivity to his or her cultural values and autonomy. We need to maintain accurate and complete race and ethnicity data to monitor disparities in care and use this information to make informed decisions related to identifying gaps in the delivery of care. It will take many years to close the racial equity gap in healthcare, but the work must be done. This is the only way to truly achieve access to care for everyone. Thank you for making the Health Policy Doc part of your day. The Health Policy Doc is here to study what needs to be done so that everyone can have health coverage. Please tune in next time as we tackle another facet of healthcare and health policy. If you enjoyed the podcast today, please rate it and share with colleagues, friends, and family. If you would like to leave a comment or a suggestion for a future topic, please email thehealthpolicydocpodcast@gmail.com. Thank you.